Simonetta is a professor in the Department of Economics and Applied Economist. I've known Simonetta for many years, mostly through the screen, we've just been saying, but we've met a couple of times through the ESRC Grants Assessment Panel. All her work is about inequalities in the labor market, in the labor force, by gender, by ethnicity, by disability, all of the things that our government should be paying attention to. So today's paper, I'm delighted, is going to be on pension reforms and women. And it's based on this publication, Simonetta and a colleague, some time ago. And we're really very delighted to welcome you. Over to you for about 30, 40 minutes.
Yes.
And then we will take questions.
Thank you so much. Thank you for the invitation. It's a pleasure to be here. When I received this invitation, I thought, oh, that's fantastic. It's my chance to go back to the paper and look at it more. But, you know, term time, teaching at me, I'm going to tell you what we did and where I'm planning to go as soon as I have the time. We finish our term, so hopefully that's going to happen soon. So the paper is joined with Marina Della Giusta, who was at the University of Reading when we wrote the paper, and now she's at the University of Torino. Okay. So the motivation for the paper is really the change in the state pension age, and really this group of women who are campaigning to get compensation for the increase in the state pension age. They called WASP, and their logo is a wasp. That's why the paper was called Stung by the Pension Reform. So we met these women, and we wanted to have an idea of how they felt about this, why they were complaining, and so on. So what I'm going to talk about is an analysis which uses secondary data, but to some extent it derives a bit from what they told us. And I might tell you a bit about the feedback we got from them while we go. So as we know, pensions are not affordable. We need to retire later because we live too long, and there's not enough people paying for pensions. So this is, it was essentially a fiscal reason why pensions, state pension is increasing. What I'm going to talk about is the first part of a long series of reforms, which mostly affected women born in the 1950s. They saw an increase in their state pension age, all of them, and those born in 1953. For them, the increase was particularly sharp, and I will give a bit more detail. You probably know, but I will give you a bit more feedback, details later on. There's different estimates of how many women are affected. They vary a lot, but you know, between 1 and 2 million women. It's essentially a lot. The reason why women are complaining is that there was no communication about these changes. And their claim is, well, you know, we couldn't really adapt on what we did, on the type of job we wanted to do, and so on and so forth. So, you know, we wanted to retire, then suddenly we couldn't. So for them, it was a shock, so a negative thing. But for researchers, shocks are actually good because they allow us to get closer to estimate the causal impact of this reform. So this is how the reform looked like. So the first reform is this green increasing the state pension age. So state pension age at the beginning for women was age 60. And then the Pension Act 1995, according to this act, state pension age would increase by 1 month for every month of age. I will give you a bit more detail in a bit. So the increase was this green bit, and these are the women born in the 1950s. And then the Pension Act 2011, which is this yellow line, change in the state pension age increased much more faster. Instead of increasing 1 month every month of a year of birth, it increased by 6 months, which is really sharp. So the main aim at the beginning was to equalize state pension age by 2020. And this would have been the green line, but the yellow line made the equalization of the state pension age between men and women to 65 a couple of years earlier, so in 2018. Now, the data that we have finishes about here in 2018. So we just look at the all this green part of the reform and the beginning of the second pension reform. So we don't look at any effect on men because for men it was after our data, but it is something we are planning to do later on. And this is still a live issue. There's still a discussion now whether we should increase the state pension age to 68 sooner than we expected. So, you know, when I looked at the birth year that were affected, and I wasn't there, I wasn't happy. Even if it is possibly, you know, far enough in the future, I think, you know, reaching state pension age is kind of a milestone for many people. So what we are going to look at is different effect of this reform. First, we look at the effect of employment on well-being of these women. This has been done before, but we wanted to compare with the previous literature, and also because, well, that's essentially the impact that what the reform intended to do: keep more people in work, so have more people contributing, besides having fewer people join from the system. Beside employment, we look at well-being, life satisfaction, and so on. But after that, we wanted to look at unintended consequences. So if you end up being in work for longer, you spend time working, would you have less time, for example, volunteering, which is something that often it is older women to do, or caring for older or for younger, or for children. And we wanted to see whether that was the case, and then also what effect this had on the finances of the student. But I think possibly one of the most interesting part for me is the differential effect that it had in different women. We wanted to see, you know, when we have reform or policies, they're one size fits all normally. And it is always useful to have an idea of how actually different people are affected. And I would say it often turns out that those who are more vulnerable are those who are affected more negatively. We should possibly take that into account. And then we wanted to see whether there was a spillover on partners. In some cases, we did find something. In some cases, we didn't. So there's a number of related studies. The closest to ours are these studies by Cribb and others, and Cribb and Emerson. They used either the labor force survey, 2009 to 2014. It is a longitudinal data set, but it covers only a small period of time, just 1 year and a quarter, so it's very short. And Cribb and Emerson, who used the Family Resource Survey from 2009 to 2015-16. And this is a cross-section. So we argue that our study is better because we have panel data for a much longer period of time. So we can see what happens when women retire. They only look at the first reform, so the yellow bit, the green bit that I showed you. And what they found that, yes, the reform was successful in keeping people in work. But in terms of income, the income that these women received was only partly offsetting the loss of state pension. So essentially, these women were still working. There's other studies, there's more than what I can cite here, that look at the effect of the state pension age on informal care. Now, when we published this paper, we only saw the first version of the paper. Now there's a new one that is a longitudinal study, the longitudinal data are much more recent. And the fact that, you know, retirement generally has a positive association with mental health. This is part of the reason why we wanted to look at different outcomes besides just employment. So what do we do? The data that we use is understanding society. We use the special license because in that way we can have the month of birth, because that is important to understand who retired earlier and who could retire later. The data that we had at that time was starting in 2009 and finished in 2017, so before actually the equalization of the state pension age in 2018. The nice thing is that it covered 8 years, so we have a long period of time where we can observe these women. So what we do, we compare different groups of women. We have like a control group. These are women that are not affected by the reform, born in 1949 or up to March 1950. They're not affected by the reform, and they could still retire at age 60 as expected. And then we have the group of women who are affected by the first reform, so born from April 1950 up to March 1953. So for those born, so in March 1950, retirement age was 60. For those born in April, retirement age was 60 plus 1 month. Those born in May, 60 plus 2 months, and so on and so forth, up to age 63 for the last group. And then we have the second reform that instead adds 3 months. So those born in April 1953, retirement age was 63. If they were born in April, the retirement age was 63 plus 3 months. Born in May, 63 plus 6 months, and so on and so forth, up to 65. And then we have a group of women who are not affected by the reform because when we observe them in the panel, they haven't yet reached state pension age. They're not properly a control group because they're not going to help us identify the effect of the reform, but it's still useful to put them in to identify the effect of other factors. So we have a good number of women moving from before retirement, before state pension age to after state pension age, so who can actually retire. 125 from this group of women who were not affected, and then 1,122 of this group, those born between 1950 and 1952. And this is how we try to figure out what is the effect of changing in the state pension age. So because the reform was not anticipated, then what we're going to do is to use difference in difference approach with fixed effects. So we have tested the common trends and the hypothesis to test the validity of this method. So what we are going to have to use different, to look at different outcomes, and I will list them in a moment. One of them is employment. And the variable that is of interest is this TIT, which is essentially a dummy for a treatment. So this variable is 1 if these women are still below state pension age, which depends on their year and month of birth. And then it switches to 0 once they reach the state pension age, which means that the younger women are treated for longer because their state pension age is higher. So what I'm going to show you in the results is just mostly this effect of this alpha. I'm not going to look at all these other things, but we add them to make sure that we compare women that are as close as possible to each other. So we have dummy for married or cohabiting, whether they're homeowners, all factors that we think might affect the outcome independently of the state pension. The estimation, we just use OLS or linear model in most cases, except in one and other. Okay, so outcome of interest, as I mentioned, we're going to look at employment first. And actually, when I read the previous literature, it wasn't clear what they meant with employment, where the unemployed were. So I decided to do both, and I think it's actually interesting. The first outcome I'm going to look at is labor force participation. So this is a variable which is 1 if women are employed, self-employed, or unemployed. Essentially, either they work or they're willing to work. And otherwise, it's 0. And for this variable employment, the only difference is where we put the unemployed, we put them in 0. So this variable is 1 for employed and self-employed, so women who have a job, and otherwise it's 0. And then we wanted to see, well, do women work a bit? Do they work part-time because they really want to retire and get more time for themselves, or do they work full-time? We tried different specification, and we ended up with this kind of ordered variable. That's where we use the ordered for it. And we have either 0 hours or small amount of hours, kind of part-time, 15 to 30, or full-time, 30 plus. And in terms of well-being, we're going to look at life satisfaction, which is measured on a scale from 1 to 7, and higher values means higher satisfaction. And we're going to look at the measure of, we're going to look at the general health questionnaires. So the 0 to 36 values ranges between 0 and 36. And generally, higher values means worse well-being. So we reverse coded it because we wanted it to be consistent with the previous one. Otherwise, it's just confusing. Okay, and this is the first set of results. What is the effect of the reform on employment and well-being? So that variable T that I mentioned, it is essentially this coefficient here under the state pension age. So we looked at labor force participation and employment, so having a job. And we can see that, okay, where I have the stars, this means that the coefficients are statistically significant at 1%. And what this tells us is that those women who are still under the state pension age, compared to those who have reached the state pension age, are 10.5 percentage points to be more likely to be in the labor market, or either working or willing to work, compared to those who have reached the state pension age. So this suggests that the reform was keeping women into work, and the average is 68, so this 10.5 percentage point would have been significant. But it's smaller when we look at the percentage of the effect on having a job, which means that a number of women actually would like to work, but actually don't have a job, either because they decided to leave it and they can't find something else, or we haven't really investigated the reason. But so women who are still under the state pension age are about 7.7 percentage points more likely to have a job. In terms of hours, which is the table at the bottom, 0 hours is essentially not working. They don't seem to work part-time a small number of hours. When they do work, they work full-time. So it means, 30 plus hours, it's a lot of the week, right? That's why then we wanted to look at whether there's an impact on other activities that women might want to do. When we look at mental health and life satisfaction, we can see that the coefficients are negative, which suggests that women who are still under the pension age, so the increase in the state pension age has a negative effect on life satisfaction and on mental health. And when we did talk to these women, they were really unhappy about the increase in the state pension age. So this ties with what we told us.
Sorry, I do have a question. Yes. The average of the variable when you look at the mental health is negative. Yes. So like you reverse the scale and you make it negative.
Yes. Yes. I just added a minus before, so that the 0 is better rather than numbers. Yeah. And in terms of unintended consequences, one of the things is, well, we know that it is often older retired women who do volunteering, who often care for the children, the nephews, the nieces, and so on. So we wanted to look at whether there's an effect on this. So the other outcomes we're going to look at is whether these women are engaging in caring activities, and this could be either for the children or relatives or also neighbors. If they do, this variable is 1, and if they don't, it's 0. We also tried with hours, but the results don't really change. And then beside activity, we could look at whether they are doing volunteering or not. Again, the variable is 1 if they volunteered and 0 if they don't. And the final variable we're looking at is satisfaction with the amount of leisure time. And this is again on a scale from 1 to 7, when higher values mean higher satisfaction. And then we wanted to look at the finances, because the previous literature suggested that these women were more worse off than before the reform. The way we do it is by using questions that asks about what we call subjective financial well-being. So there's a question in the data set that asks if how do you manage on your finances? So this variable is, we coded it as 1 if they tell us that they just about getting by. They find it quite difficult or very difficult to manage on their income. And if they tell us they're doing all right or doing well, then they're 0. We also have a separate variable, which is 1 if they told us we are behind with bills. We also try to include mortgage. That decreases sample size and the results are similar. And then we have satisfaction with income, so a bit more, subjective measure. Again, is on a value, on a scale from 1 to 7. And these are the results. I was surprised. That's why I tried so many different specifications. What we find is that, there's no effect on caring or volunteering activities. So the increase in the state pension age, according to us, that's other papers don't necessarily agree. Women still are as likely as before the change in the state pension age to do caring and volunteering. But what we see is that they have a decrease in satisfaction with the amount of leisure time. And this makes sense because now they're more likely to work full time. They're still as likely to do caring and volunteering as they were before. What has to go is your leisure time, is your time for yourself. And this is consistent with the fact that we see that they're less satisfied with their leisure time, the amount of leisure time. And in terms of financial well-being, those who are still under the pension age are more likely to tell us that they're struggling financially. That's the first variable I mentioned. They are more likely to be behind with bills, and they also have a lower satisfaction with their income. So, financially, they're not doing very well. And after that, what we wanted to do is to look at differences across different types of women. First, we wanted to see whether, the two different reforms had different effects. Because the second reform increased the state pension age much faster than the first one. I'm not going to show you the results because we didn't really find a big difference. We found that the reform did have the first reform had an effect, but there was no additional effect of the second reform. Now, this could be for many reasons. It could be because actually we don't have a lot of women affected by the second reform. It could also be that, state pension age increases. It doesn't matter if it decreases, 2 years or 2 months, it might still have a negative impact on people. That's something that we want to look at more in detail later. What I'm going to show you instead is the effect that models that compare women with a university degree and without a university degree. So the way we do it, we still have the same outcome variables Y there, but the way we use the treatment variable is using interaction. So in the case of education, this DI0 is women without a university degree, and this DI equal to 1 is women with a university degree, and we don't have this part here. And for marital status, we wanted to compare women living alone and women with a partner. When we think about education, we were thinking because typically if you have a university degree, you have a better job. It pays better, and you might not be so affected if you have to work for a bit longer because maybe you like your job. And in terms of marital status, when we were discussing with these women, they said, I decided to retire anyway, because even if I didn't reach the pension age, because my partner allowed me to, so it was good. But then I was really unhappy because I felt there was a burden to my partner, because I still retired, but I didn't get my pension. So I thought, maybe there's a difference between the two. And actually, we did find that there is. Now, in terms of level of education, these are all the variables that I mentioned we used before. We see that there's, so the way to read this is the average effect under the state pension age, and this under state pension age times university degree is the additional effect for those who do have a university degree. So I'm going to focus on this row here because it's the additional effect. Okay? So we see that there's no difference between those with and without a university degree in terms of being active in the labor market. But those with a university degree are more likely to have a job, which means it is those without a university degree who end up being unemployed. So still in the labor market, haven't reached state pension age, and essentially they have an income. And when we look at hours, which is this part here, we can see that there's no additional effect. So for those who are in work, they're still all working full time. Doesn't matter whether they have a degree or not. We do see a decrease in mental health and life satisfaction, as you mentioned before. But for those who have a university degree, there's a protective effect because their mental health, actually comparing these two coefficients, possibly they're not affected or you might have a slightly higher mental health. We didn't find that much in terms of life satisfaction. We also didn't see much difference in terms of activities, so caring, volunteering, or the amount of satisfaction with the amount of leisure time. So again, there's no difference across these women, but there's a protective effect on finances. Well, you know, if you have a university degree, you do have a better job that pays better. So these women are less likely compared to those without a university degree to tell us that they are struggling financially, they're behind with bills, and comparatively, they have a high satisfaction with their income. So good for them, but for the others. And in terms of marital status, we also find that there's a protective effect of having a partner. Again, same variables as before and same way of reading the table as before. So the focus is on this row here that tells us the differential effects of women who are married compared to those who are married or have a partner compared to those who are alone. And again, there's no difference in being active in the labor market, but those with a partner are slightly more likely to have a job. And here we were thinking of maybe it's a network effect. If you have a partner, they might tell you, actually, I know there's a job there, you can apply. There's a protective effect on mental health and life satisfaction, and this is where actually what we were suspecting, because you can have support from someone. Even if you're depressed because you couldn't reach your state pension age when you were expected. Again, we don't find any difference in terms of hours of work. We don't find any difference in terms of activities, but again, there's a protective effect on the financial well-being. And this is consistent with the idea that if you live with a partner, you have someone with an income that can help support you. Final thing was we wanted to know whether there was a negative effect on the partner. So we did look at only those women. We concentrated on the group of women with a partner, and the way we structured the model, everything is about the partner, so the male partner, and the only thing that applies to women, that relates to the women, is the treatment. Okay, so how does the partner fare if her woman is affected by the increase in the state pension age? No effect. So I have the results if you want to see them, but because there's nothing statistically significant, so the man, okay, they're going to support their partner, but it's her problem to some extent more than he is. I mean, I'm joking here, but we didn't find anything here. Yeah, so that's it. So we conclude that this change in the state pension age increased labor market participation and a bit less so full-time employment. It didn't really affect the different type of activity that women might do, but it negatively affected their satisfaction with the amount of leisure time, and we kind of infer that it negatively affected the amount of leisure time itself, and also had a negative effect on financial well-being. But some group of women are partly protected, but less negatively affected than others. And these are those with the university degrees and those with a partner. They are more likely to be in employment, they have better mental health and better financial well-being. Then we didn't find any difference between the two. It's a lot we would like to do. We are in 2024, much more data. Now, the state pension age has increased for men too. Have they been affected as much as women? I think we would like to look at that. And also for women, we would have like a longer time span to be able to see whether actually there was a difference between the first and the second reform. We would like to look more in terms of heterogeneity, gender, comparing men and women, but also ethnicity. Should we have enough sample size? Because we know that ethnic minorities have different types of jobs, different types of pay, different family structure too. So there might be some protective effect and some negative effect. Education type of jobs, lots of things we would like to do. And then one thing that we want, I'm not quite sure whether we can do it, but when we were talking with these women, not all of them were affected in what they did. Some, they still decided to retire. So who can actually retire even if they haven't reached this state pension age? Who doesn't and has to be working for longer? Does it depend on their type of job, on their family situation, whatever? So that's something that we would like to investigate. And also the effect on the income, because it is likely that, you know, the remaining work might have a positive effect. We would also like to do more in-depth analysis of adjustment before and after the state pension age. Because I thought the reason why we looked at hours, we thought, okay, maybe women who wanted to retire but they can't, they might decide to at least decrease the number of hours. We didn't find that. So we have yearly data, so maybe the pattern of adjustment is different. So I would be interested to see how that looks. And then we had a pandemic in the meantime, and now there's a lot of discussion of having more people out of work because of health reasons. How this you know, combined with the changing state pension age, and very big questions. So that's where we are. Yes. Thank you very much.
Thank you.